Good evening, if you're on Eastern Standard Time. Welcome to Writing Fantastic Diseases in a Post-COVID World. I'm your moderator, D.H. Aire. I'm an indie author. This is my 21st book, newly out, Bigfoot is Not Your Friend. And that'll be the only plug I do till the end. I'm going to introduce the topic in a moment. We're going to be taking questions through the Q&A, and after the session, you're welcome to meet any members of the panel on Discord in the water table room for further discussion and follow-up from this panel for at least a few minutes afterward. So again, you're in Writing Fantastic Diseases in a Post-COVID World. The past year has taught us a lot of valuable and interesting lessons about the way the pandemic can affect society at all levels. Now that you can assume your audience has firsthand experience at living through a pandemic, how will this change how you write about similar situations? What are new ways to convey feelings of horror, distrust, and paranoia? If you're a writer of future or near future societies, what do you plan on changing about your world building? I'm going to have each panelist introduce themselves. I'm going to start with Seanan, one of our guests of honor for Balticon.
Hi, so I am also Mira Grant. And as Mira, I write biomedical science fiction thrillers, often in consultation with the CDC. So I have done a lot of fictional pandemics, and they make me very happy. So that's why they put me on panels about diseases.
Yeah.
Hi, I'm JL Gribble. I write near future, alternate history, urban fantasy, the Steel Empire series. Steel Victory is the first one. Steel Justice, the 6th book, is coming out this summer. And I'm currently writing the final book, which has a pandemic in it, which I plotted back in 2016. So good timing. But in my day job, I'm a professional medical editor, and I currently specialize in HIV care. So that is why I volunteered for a panel about fictional diseases, because I spend my day dealing with the care and prevention of a very real life pandemic.
Jeanne.
I'm Jeanne Adams. I write urban fantasy, paranormal romantic suspense, and space adventure with my friend Nancy Northcott. And I was in the middle of writing a plague book because my character in the Outcast Station series is an epidemiologist when the plague hit. So I had done a tremendous amount of research, so that's why I'm on the panel.
John.
Hi, I'm John Wiswell. I'm a disabled writer who lives where New York keeps most of its trees, and I have been chronically ill for most of my life and only started writing about what it's like to live with chronic illness in the last 2 or 3 years of my speculative fiction career that's been more than a decade long. It's a really awkward time to start writing that sort of thing. The demand sort of shifted, but I find it utterly fascinating, especially as we roam more into the speculative. And so I've been publishing a few essays recently, the most recent one in Uncanny magazine about what authors are doing with weird plagues and what they were doing right before and how it's begun to change. So this topic is exactly right up my alley. Thank you so much for having me.
Okay, so from the topic pieces, the first question I want to pose to the panel is, now that you can assume your audience has firsthand experience at living through a pandemic, how will this change how you write about similar situations? Seanan, can you start us off?
So I don't know that I will be writing about any similar situations in the future because this pandemic has literally destroyed my optimism. All of my books that have involved pandemics have assumed, clearly wrongly, that when faced with a deadly disease that just spread through the population, people would respond to it with a small fragment of both self-preservation and preservation of community. You know, I always knew America had a eugenics streak a mile wide. I didn't think we would go so very quickly from the Chipotle is closed to go ahead and kill grandma. So that is really going to impact my future works. I don't know that I'll be able to write about any further pandemics. I also don't know that saying we've survived COVID-19, a lot of people didn't. We're not actually in a post-COVID world, and we're never gonna be. We have so much vaccine inequality. We are going to keep getting variants. We are going to keep getting mutations. And frankly, out of all of the plagues that the World Health Organization has been kind of tracking to see if they were going to come and visit us, the coronaviruses, this has been a simple pandemic. Wear a mask, stay indoors, you're fine. Like, that is not the same as getting Hanta more widely into the population or getting Henda into America's horses. You know, there were rumors about airborne rabies out of Arizona a couple years ago. Airborne rabies is game over. We're done. So we're going to have to amp up our fictional pandemics really, really hard. It's difficult to write about societal response to them in any way that doesn't make literally all of humanity look like assholes.
JL.
So when I first plotted the pandemic that I'm currently exploring in the final book in the series, so I was like, hey, this was going to be a big deal. I kind of came about it from a very narrow view because most of my exposure to discussions about pandemics were from healthcare professionals and epidemiologists. And living through this, and like Seanan said, seeing how people are just kind of assholes has really helped me like amp up the tension in the book, especially because in the story, it originally only is supposed to affect a subsection of the population, and people just don't care. And if people in real life don't care when it could potentially affect everybody, that, you know, ended up really informing how I made changes to the story. And honestly, just because I do so much with HIV care and how people even kind of act like some people even deserve to get illnesses, you know, that's, yeah, I'm with Seanan. Like, I never expected much of society, but living through this has really changed how I'm writing about it. And I don't know that I'm ever going to write about one after this because it is really depressing.
Jeanne.
Well, I actually had to stop writing the book that I was writing because it was so depressing. I mean, my husband actually sat me down and said, you can't do this right now. It's too much for you. And I realized he was right. I think the ways in which it will inform future work, however, is I think one of the things that we saw with this was that if it is not a visible symptom, people don't take it seriously. And if I want it to be a plague that everyone takes extremely seriously, it's going to have visible effects, or it's going to have to be dropping people in the street. It's going to have to be much more intense in terms of its symptoms and effect. Because as both Seanan and JL said, I mean, wow, never expect what we got. Never in a million years. A lot of my research had been done on the 1918 plague. And basically, the government said, this is what you will do. And so people said, okay. Just like in the 50s, they said, here's the vaccine for polio. This is what you will do. You will line up the school kids and you will give them a shot. People went, okay, well, we don't do that anymore. And with all the misinformation on the web, that is something that I think all of us as writers are going to have to contend with.
John.
So I'm immunocompromised and I have defective lungs. If I got COVID, you're gone immediately. And so, but also most strains of the cold are the same, have the same outcome for someone like me. So I've lived most of my life like this. And one of the big shifts of the pandemic was watching all the abled people around me suddenly learn the nightmare of what it is to be like me, which what could make one quite cynical, but instead I actually will probably change some of my fiction for the better, For instance, I'm very happy to be able to write a generic protagonist who understands why you would put a mask on and stay 6 feet away from somebody for once, or at least an American protagonist. You know, most of the other countries in the world that I've ever been to have a much more level-headed approach to this. The idea that one could now expect an average person to have some access to information is terrifically interesting. And also, were I to write another pandemic story right now, I would probably leverage more of the axis of nervousness on where you're getting your information from and what is trustworthy. Right. Now, you could just say that, like, you know, like Fox News burns the world to the ground, but I am unlikely to write the story from the point of view of that character who's watching Fox News 24/7. I'm much more interested in writing about how people band together against weird plagues to share both physical resources that are useful, like rubbing alcohol and breathing masks, but also knowledge that works. Because one thing that saved a lot of friends in my small New York chronically ill community is sharing where to get, not just sharing resources, but sharing the best places to get resources. That's an information network. And I can't imagine writing a story in this kind of context without emphasizing those kinds of networks today.
Okay. I want to remind the audience that you can post questions to the Q&A. My second question to the panel is, what are new ways to convey feelings of horror, distrust, and paranoia?
So one experience—
I'm having thunder and lightning going on as I say that.
So one experience that I had through this experience over the past year is, I can't tell you where I work because I'm not here as a representative of who I work for, but because of my job, I did end up assisting with, I do work for a major health organization, and they put out their own guidelines for how to diagnose and effectively treat COVID-19. And so I got to sit in on a lot of conference calls with medical professionals, going through the discussion of, well, we think this might work, so how do we get access to it? How do we get it to people that it might care for? And to literally have, you know, medical professionals that I know and I trust because I know them in real life talk about, well, we literally only have 20 doses of this medication that might work. How do we figure out who it goes to? And those were some dark months last spring, and I would end these conference calls crying. And that has definitely inspired me to know how to better write the horror of the situation that a pandemic is. And I joke that I'm not a horror writer, but I keep coming up with all of these horror ideas, and this past year has definitely aided in that.
Yeah, I think one of the things for me will be that, I mean, I don't know if you all had this on your bingo card, but some of the odd things that people went for, I mean, toilet paper, who in the million years would have thought that that would have been an issue? Well, I thought some resources would be, but it wasn't toilet paper that I sort of had on my list. But the other thing I think is that surprised me and will influence my work is the immense amount of anger that people had, that sheer rage that people had about other people hoarding resources, as well as those lovely stories about people who said, well, of course I've got toilet paper. Do you need a roll? And, you know, several of our neighbors were wonderful about things like that. We're like, hey, we've got a line on, you know, 10 bales of toilet paper. Does anybody need any? You know, so our neighborhood network, I will incorporate that into my stories because that is not something I ever expected either.
John, you want to comment?
Yeah. So one avenue of horror that I was interested in before the pandemic, but now I'm just fascinated with, is how you're treated when you exhibit symptoms. how difficult it is to get care, if you're going to be met with violence from people who don't want you near them when you don't want to be in their orbit to begin with. And how do you find respite from it? So obviously the question is about horror, so I won't stray into how one relieves that tension, but that's something I think that's inescapable, because we already in the history of pandemic sci-fi had the habit of anybody with the thing is dead and probably like has liquefied. The diseased, the ill, don't get to be characters in their own story too much of the time. And my God, I'm so happy that some of my friends survived exposure. Not everyone did, and it's devastating, but I am equally elated that some of them I can still ever see them again and talk to them again. And I could never elide them as living agents in their own story, because the story is primarily about them. And there is a different kind of tension around the classic scientist grandpa who's on the race for the cure, and what it is just to be somebody with a condition that you don't completely understand in search of relief and hopefully treatment. I think that's definitely something that I'm not that I would explore. I will explore it. That's something I won't be able to avoid writing.
I want to know how Seanan predicted the toilet paper.
Yeah, I did. So I hate plugging my own books, but if you read the Newsflash trilogy, it's literally about a coronavirus-driven pandemic outbreak that is exacerbated by false news, where only people coming together to attempt to support each other actually enables us to survive and rebuild after the literal collapse of global civilization. I killed off like 45% of the world. I accidentally reversed global warming. It was a whole thing. But yeah, toilet paper and tampons. I was expecting a much bigger run on tampons than we got. I did not predict the flour and yeast because I'm not a baker. And we're all going to have holes in our ability to see things.
You underestimated the effect of hipsters on the national culture.
I did. It turns out that writing this series 10 years ago left me 100% prepped for modern pandemic realities.
Well, I'll tell you, I'll never be without a back stock of toilet paper again.
Yep.
And I never ran short, and I didn't hoard, but I will make sure that I am never short again.
Yeah, no, when we started having the reports, I was at a convention in Biloxi, Mississippi, when I really started going, okay, this is concerning. And I called home and asked my mother, who lives with me, to please go out and pick up a big pack of toilet paper and a flat of water to supplement the disaster preparedness kit. And her response was pretty much, why the hell would I do that? But she did, thank God.
Go, Mom.
Otherwise, it would have been washcloths and corn cobs around here.
So piggybacking on that, there's in the Q&A a one-line question that is, did any writer before this pandemic in any significant way get this pandemic right? So
Seanan.
Seanan, you answered that, but I'm trying to check quickly with the rest of the panel.
So I will admit that my post-apocalyptic fiction habits tend more toward the natural disaster, just because I've already lived through a volcano. So I don't have as much experience reading pandemic fiction.
I've read a few, but none of them, none of the scenarios were such that they were parallel. And so therefore.
Yeah.
You please, Seanan.
Sorry, go ahead.
Okay, just was going to say that I'm not convinced anybody got all of it right, nor should any one novel be tasked with doing that. But the one thing that felt far-fetched in Josh Mellerman's Bird Box that has come around to be like completely disastrously true was at the time I was like, oh really? There's a villain who just doesn't believe that this thing's a problem and goes into other people's communities in order to try to rip off their blindfolds so that everybody will be exposed and that'll fix the problem. That's ridiculous. Well, no, turns out Josh was disastrously correct and prescient about human on human. Humans are the real monster's antagonism. He really hit the bullseye. Seanan, you were going to say something.
So, not to sound like I am downplaying any of the pandemics of living memory. I'm not. But from the perspective of how many people are dead, COVID-19 was not a very good pandemic. I lost people too. I'm immunocompromised and I'm part of the disabled community out here on the West Coast. Every death is a tragedy, but it has a remarkably low kill rate, even in the more vicious variants that we have right now.
Yeah.
HIV is kind of the worst possible starter pandemic for a culture because it is actually to some degree behaviorally based. If you just stay away from people, you can protect yourself from it without taking any efforts. So COVID-19 and HIV both have enormously high body counts. They are tragic things. I am not downplaying them at all. But from the standpoint of, can I write a book about this?
Mhm.
They're kind of boring pandemics unless you want to write a 30-year book. You want to be dealing with something. It's got such a low kill rate. Tell me that long COVID liquefies your organs in 5 years, and now maybe there's some good fiction there. You need something for a fictional pandemic that kills a lot more people a lot faster. Celia Green has just commented, we don't have accurate information from India and much of Africa, and that is true. There could be a much bigger, much worse variant already moving through the population. And we'll find out very soon because of vaccine inequality and the fact that we're never going to hit herd immunity.
And the
Yeah,
fact that as terrible as the American reaction was for it, my spouse's family is all from Brazil, and if we thought Fox News was bad here, Brazil's reaction was even more of a train wreck. My brother-in-law's father just passed away recently, and so I honestly just waiting for the worst variants to come because of the horrible combination of vaccine inequality in places like India that don't have, they don't even have clean water for hand washing for a significant portion of their population. And in countries like Brazil, where the leadership from the top has been poo-pooing it from day one.
Well, and as Seanan says, when you look at things like the bubonic plague, or you look at even the 1918 pandemic, people were literally dropping in the streets. And there were some communities that did not have enough people left to bury the dead. Mm-hmm. And Philadelphia, for instance, lost 15% of its population. Today, Philadelphia would lose 600,000 people just in Philadelphia if it were, we're at what, 622? I can't remember what the latest number was, but when you look at that, Philadelphia alone would have lost that if this were the Spanish flu. So Seanan's right. This was a test run and we failed.
Yeah.
Okay, so there's some very interesting questions in the Q&A, but I'll come back to them after covering the third question in the topic. If you're a writer of future or near future societies, what would you do to plan on changing about your world building? Seanan, you first.
Welcome to Seanan's biggest pet peeve. Quarantine is presented in the majority of pandemic fiction. There was a book called Survivor's Song released very shortly into the COVID-19 pandemic. It's by Paul Tremblay. The entire moral of the book is if you're pregnant, it's okay to break quarantine. It doesn't matter if thousands of people die or are put at risk because of your actions. You're a pregnant person and you are thus infinitely more important than me. I have been beating this dead horse with a stick my entire life. I think it's incredibly irresponsible of authors to ever present breaking quarantine as a positive thing, as something that should be lauded or supported. Now, I do also think it's important to specify what quarantine means on a disease by disease basis. I had a tapeworm for several years voluntarily. It was a research project. And during that time, I did not prepare meat for other people. I did not touch meat with my bare hands, no matter how clean, to feed to other people. That was the extent of the quarantine that was necessary for me as a person carrying a tapeworm. Someone with HIV does not need to be quarantined in the same way that someone with totally drug-resistant tuberculosis does.
Yep.
And people with totally drug-resistant tuberculosis that we let get on airplanes. Get on airplanes and then they get mad when they're asked to get off the airplane. planes. That is not okay. The fact that America frames violation of quarantine as personal liberty, as something we should celebrate and applaud, is a crime. And if you are a storyteller making up fictional stories and you encourage this schema to go out into the world, this trope, this idea that I'm too good for quarantine, you are doing material damage to the world around you and to people you will never meet. Ditto with any plot that involves, oh, the vaccine secretly contains an evil, bad, awful thing. I read a book where the zombie virus was put into a flu vaccine. So the zombie apocalypse was triggered by a campus flu vaccination clinic. I actually threw the book at the author's head.
There was a book that I read in the early 2000s that I can't remember the name of, and I'm not gonna encourage people to read it anyway, but the pandemic in that book was based on a result of an HIV cure. So
yeah, and there's a movie, very popular movie, that is, the pandemic is based on a cancer cure. And it's
That's I Am Legend with Will
really?
Smith.
Hate that movie.
Yep, it's a bad movie.
It is.
Earlier today at the Bad Movies panel.
For so many reasons.
John, I don't want to leave you out of this one.
Yeah, and I don't have anything to add on this particular dead horse. The stick has snapped in half, but the stick was snapped in half for very good cause. To go a different route, another thing that I would change about my world building going forward is I have to pay more attention to skepticism. Either toxic skepticism or healthy skepticism about where one's information comes from. And I know that I touched on that earlier, but going forward, how could I have a near future story set in a world where I haven't thought through where people get their news about pandemics from and why they believe it, where up until now, I'm not the only writer, but I'm certainly a writer is guilty of the characters just basically believe whatever they hear on the TV that's on in the background to dump exposition, which is like a perfectly lovely thing to do if you don't care about that element of your world building. But I'm now deeply invested in getting people to a place where they understand where to look for information that keeps them safe. And and this is my, I don't know, not optimist, but like my desire to try to help people be a little bit better about disease and chronic illness is create stories that foster better behaviors as you come in risk. So anyway, that's definitely something I'll be looking at.
Jeannie, did I have you answer the question, or you were just commenting?
I think so.
Okay.
I think so.
JL, you good on the question?
yeah, the thunder and lightning just hit me too. So
Oh man.
Like I said, I don't read a lot of pandemic fiction, but what Seanan says about how in some cases it's like fiction portrays it as okay to break quarantine if you're kind of like the hero of your own story. The thing that I've been really disappointed about through this whole thing is actually the reaction of the US military, because I'm married to a guy in the military, and just how they've kind of treated the whole, well, everyone else should stay home, but you're expected to still come to work, even though you could totally do your job at home. And once a month, we're still going to bring in everybody from, a couple thousand people from around the state and cram them onto base for our monthly drill meeting, just because that's what we do. Pandemic, what pandemic? And it's just, if these are the supposedly the heroes in most of the stories that we read are people in the military, and the military can't even handle a pandemic. So,
and you'd think they'd have figured that out in after 1918.
Yeah, absolutely.
And the casualty level from military bases.
So I'm going to go to questions in the Q&A. From Judy Blackburn is, one of the truly scary things to me of living through the COVID pandemic, was being uncertain when or if there'd be a vaccine. Before then, my experience with pandemics had been stories about the past with happy endings. How could this new experience for this generation impact how we tell future stories? Thoughts? Seanan?
I don't know that I have ever read a pandemic story with a happy ending.
Okay.
For it to, I am a person who loves pandemic fiction. It's something that makes me happy. I am also a person who has high blood pressure for some inexplicable reason as I read books that are guaranteed to make me incandescently angry on a fairly regular basis. I want your virology to be as close to accurate as possible. You know, everybody loves World War Z. I spiked it off a wall because the virology in that book is so appallingly bad. So for it to be a good work of pandemic fiction, or even honestly deserving of that title, I want a kill rate of 10 to 20% minimum. I want massive societal disruption. I want to see you deal with what a pandemic does. And a true pandemic book, even if we find a cure at the end, even if we magically are able to rebuild society from whatever happened to it, the dead people are not coming back. Or if they are, it's because they want to eat you. And if I have died of COVID, I don't care that there's a vaccine now. I'm pretty well solidly toasted. It's not a happy ending for me.
Right.
Honestly, the only way this is going to change how I write about pandemics is that lack of optimism. It's going to be so much harder to actually believe that people can set aside their personal interests in favor of inconveniencing themselves even a tiny little bit.
JL?
I'm just really happy that the pandemic I'm writing about takes place in a fantasy world where the pandemic starts as a bioweapon and magic is going to fix everything. Because if I was writing it in, you know, even a near future SF world, like, man, there would be so much death. The one thing that I would change now is, Shannon, you mentioned how you accidentally fixed global warming in your fiction. Well, we know for a fact now that everybody staying home is not going to fix global warming because random people driving their cars around is not actually the cause of global warming. It's the corporations who are mass producing things. So no one's fixing that anytime soon, just from, you know, by our bootstraps.
Jeannie?
Well, I think that the generation who's coming along with this, I have 2 teenagers, and their sheer disgust at the level, and their friends and their colleagues and people, they know kids across the country that they're, you know, and actually around the world, that they're connected to. Their generation is horrified at the way we handled this. Mm-hmm. And so in terms of this experience impacting how you tell future stories, I think that I might have some optimism in the fact that that they are so horrified how we handled this. And, you know, we lost people in our family. My sons are still grieving. I'm still grieving. When you lose someone to that, it makes it right real. And I understand someone who said, you know, the questioner who said, you know, the uncertainty of whether there would be a vaccine, especially given the disarray of the government laboratories that normally would have been right on it a lot sooner than they were. And the international cooperation. I mean, in much pandemic fiction, once things get sort of going, there's international cooperation for solving the vaccination thing. There was some of that in this, but, you know, it's certainly going to impact me in terms of the optimism and with which I write that kind of thing, because I never in a million years would have thought that we would have not put aside our differences to do this, fix it.
Yeah, I think that. Yeah, I think that disgust is going to continue to grow. Unfortunately, the disgust is not only based on a failure to deal with the pandemic. It's a failure to deal with our healthcare system. It's a failure to address climate change in a satisfactory fashion. It is the misprosecution of the war on terror, or even the existence of the war on terror. The jadedness of the youths is extremely valid, and I have watched it greatly undermine their belief in in the status quo of governmental aid, but there's also a profound desire to see whether it can be reformed or whether it just has to be replaced. And so I think part of the generational change will be a serious exploration of what they can do in order to replace these systems that have so badly failed them. And that's going to apply both to this kind of catastrophe and every other one down the line.
Okay. Before I go to the next question, most of you don't know what my day job is, but part of my day job this year, I've gotten to go out and map out people's burial plots for their funeral. I run a congregation, and we've had to deal with the pandemic of someone's died. How we would normally ritually handle their burial has been very different under COVID. And I've buried more people in the past year in my congregation cemetery than they've ever probably buried in 10 years.
Right.
And some of the people we buried survived COVID only to die of old age, 6 months later. It's just really ironic and strange. And as we come out of this phase of the pandemic and they're dropping barriers, my whole congregation is like, is it too soon? And my concern is, who am I not going to see after 18 months that I saw at every service on the weekends? Right? So it affects me as a writer because I'm arranging funerals.
Right.
When that's not really the key part of my job, but it's become a much bigger part of my job under COVID for the last 14, 15 months.
Well, this whole thing has exacerbated a mental health crisis that was already existing and was being treated as a subculture almost. And, the fact that we couldn't mourn our dead, we couldn't gather to do the normal rituals that we do to help each other through those difficult times. That's going to have a very long-term effect that we don't have any clue about yet.
The questions in the Q&A are kind of interesting. One is, who might get blamed without any evidence for causing the next pandemic in your writing? What might happen to them? To me, that's a disturbing question.
Yeah, but it is one we have to address. I mean, in real life or in fiction, it's going to be any group that people in power can other. You could be if a political party in power has a grudge against a nation, wants to be aggressive towards a nation. I don't want to use the racist terms that have been deployed towards the Chinese. But you will see this. I mean, this is my deep pessimist side, I guess. But I mean, you're going to see a pandemic in the foreseeable future blamed on South American and Mexican refugees. Absolutely. And we need to prepare and resist against misinformation like that. And also we need to acknowledge that it's also not a poor person's fault that they were exposed to something and then desperately tried to find help for their children. The idea we need to globally resist the notion that you deserve your health problem, that you deserve that any of this is meted out in that fashion. But you're going to see the people who can't push back politically are going to be blamed politically, and you're going to see people without the financial resources exploited. That's my profound pessimistic belief.
I don't actually think that you're wrong. There's a reason we stopped naming diseases after the place where they originated.
Yeah.
And, part of that is the Spanish lady who was first found in Kansas City, not Spain. That's entirely a spin job by the American. What? I'm in the middle of a panel. No, I don't need anything from the grocery store. Thank you. The joy and wonder of doing conventions from home. But she was first found in Kansas City. She was named the Spanish flu because the American government didn't want people to think Americans were sick. And that is a big part of the problem. The Calvinist attitude toward health, this idea that health is something that you earned, that sick people
Right.
are somehow morally off. You did something.
Right.
Why are you sick? What did you do?
Right.
And a huge amount of public response to COVID-19 has basically been built around that. You're sick. Let's figure out what you did wrong. Well, what I did wrong was have lungs and get exposed to an airborne disease.
Yep.
That I may or may not have had any reason to think I was exposed to. I have friends in Melbourne, Australia. They've got another outbreak going there now. It started in one of the quarantine hotels with 2 passengers who had both received negative COVID tests. One of them opened the door of his room to receive food, which is one of the only reasons you're allowed to open your door in that hotel. The other opened his door about 10 minutes later, and the first had become symptomatic in the time between his test, which came back negative, and opening that door. So now they've got a spreading outbreak going through their city. And we hold people responsible for their health in a way that is not realistic. It's not how diseases work. You can take steps to protect yourself, which obviously you have done, but you can't do that if you don't know something's going on.
Right.
And
Yeah,
you
I
can't
mean,
blame.
Or if there's no safety net for you and you have to go to work so that because you have to feed your children.
yeah,
My
absolutely.
mother works in a grocery store.
And then, I mean, my mom got one of the very rare false positive COVID tests, and she found out the day after she'd had dinner with me and my husband, because it was me and my husband and my parents in our little bubble. And he, obviously had to stay home from work for 2 weeks until we got our negative tests. And there was definitely, it wasn't overt, like, oh, what did you do? But it was very much, well, you did something wrong, which is why you now have to stay home from work and quarantine for 2 weeks. Like, we hope you don't get sick. I had the regular old flu last summer. It turned out not to be COVID, thank God. But, when I got sick, it was like, I felt super guilty. Like, oh my God, what did I do? And I've been working from home for over a year, to the point that we actually got rid of our offices, and now I get to work from home forever. But I still felt incredibly guilty for just getting one of the very few cases of the flu that we actually had last year.
Yeah, my son and I got it prior to the acknowledgement that there was something going on.
Mm-hmm.
And we both got negative flu tests, and both his pediatrician and my doctor said, it's just a virus going around. Don't worry about it. I'm thinking, I have never been that sick. Maybe once when I had like pneumonia and a sinus infection and bronchitis at the same time, maybe then. But I think Seanann's put her finger on it. It's that it is an origin story kind of Calvinistic thing and Calvinistic is a great phrase for it, that if you are godly and wonderful and doing all the right things, you won't get sick. And somehow we've got this notion that people who are sick or who get sick have somehow, as you said, JL, done something wrong. And we got to fix that. And I don't know how we do it. I have no idea how we do it.
Yeah, someone shared that on a military base not far from here, a child came down with COVID in their military elementary school, right? And the family was therefore shunned by everyone on base. And then when the next family got a positive test, they didn't want to tell anybody because they didn't want to be shunned.
Right.
Mm-hmm.
Which meant that they possibly and probably spread it.
Mm-hmm.
Yeah. We had that situation in our school system in the DC area with measles a couple of years ago. And the actual person who was the original patient 0 was an American child. But all of the immigrant children were focused on, because they come from countries where people don't vaccinate. And it was such an irony to me. Here we are 2 or 3 years later that it's like, oh, we're against vaccines. I'm like, you weren't a couple of years ago when the business outbreak happened. But I think John actually put his finger on it too, is that we will have these crazy ass people who are saying, you know, stupid stuff on Fox News, going after a particular category at some point, because that combination of you did something wrong and you're some otherness that we want to, that politically we can attack because you're not powerful. That's a brewing problem.
Mhm.
Yeah.
So
what-
we've just gotten our 5-minute warning. So I hate to shut it down, but I want to make sure everyone has a chance to share final thoughts and do your commercial message before we finish. Okay, Seanan, excuse me.
I have heard more amazing pronunciations of my name this panel. It's kind of great. It's Seanan. If you had a friend named Sean and you wanted to come into your house, you would say, let Sean in. So unless you're Charlene Harris, she's allowed to call me Seanan. I will be here all weekend. I have panels tomorrow, Sunday, and Monday. I don't really have anything I want to plug. I figure you'll either Google my name and find my stuff. It's very easy to find from my first name, or you don't care and you won't. And either is fine. You know, I want y'all to read my books, but it's not that big a deal. So I do want to note the one positive thing I can say for sure has come out of this whole situation. If you're a cat person, there is a disease called FIP, feline infectious peritonitis, which is a coronavirus-based disease that just comes up in cats. It's a disease that's commonly found in their respiratory system. It folds the wrong way, like it thinks it's going to grow up to be a prion, and then your cat just essentially melts from the inside out. This has been a 100% cat killer for as long as we've had domestic cats. The focus on coming up with new coronavirus vaccines and treatments has actually given us a viable treatment for FIP for the first time. We are now able to save something like 80% of cats who get sick, whose veterinarians are aware that this treatment is out there and available. And it's mostly been buried because of Corona. So one good thing has happened. We have a treatment for FIP.
JL.
I am reading from my series tomorrow at 1:30, but as of right now, I'm going to go watch The Old Guard because they are letting me, lead a panel on The Old Guard, which has been my current obsession through the pandemic. So come geek out about the opposite of pandemics for immortality tomorrow night at 7. Jeanne will be there too. And I guess my good news that I'll share is another pandemic that we are still quietly living through for the past 40 years or so is HIV. And there is viable HIV treatment that is down to 1 pill a day. And if you get your viral load so low, you can't even pass it on. So HIV is still scary, but it's no longer a death sentence. So that's good stuff too.
Jeanne.
Well, as a genealogist and doing all this research, the value of vaccines has never been more vividly in the public eye. And so I am grateful for that bit of news. For anybody who wants to find me, as Seanan said, you can Google me. It's not hard to find me. I'm also on Continual, which is on both Facebook and YouTube, which is a great series of author panels and that sort of thing. It's kind of like a con that never ends. And you can find me on the web, and I spend way too much time on Twitter.
John.
Yes. I'm going to say next weekend, I am going to either win or lose my first Nebula Award. And if you would just like to pop onto Twitter at my last name and wish me good luck in either of those. If you'd like me to lose, come tell me. If you'd like me to win, come tell me. That would be the best possible follow-up. And just thank you all so much for coming out. And thank you for caring about this.
Congratulations, John.
Yeah,
Thank you.
I'm DH Aire, happy to have moderated this wonderful panel and appreciated all the questions that came up in the Q&A, whether I was able to get to them or not. You can find me at dhair.net or on Twitter, where you can see right below with my name there. You can find me on Gather. I've got a booth on Gather here for Balticon. We are going to Discord from here for those who want to ask some further questions at the water table room. So if any of the panelists can join for a few minutes, we're happy to answer a few more questions in Discord. So have a good night and enjoy Balticon for the rest of Memorial Day weekend.
Great to be on a panel with y'all.
It was a pleasure.
Bye.
Thanks, everyone. Bye.
Good night.